Hey everyone, this is Dr. Fiume with Rankin Fiume Orthodontics. I wanted to talk to you a little bit today about kind of the ideal age for your child to be seen for their first orthodontic evaluation. So the American Association of Orthodontists recommends age 7 as the ideal age for your child's first visit. And there's several reasons why, but basically at that point in a child's growth and development, it's a really good time for us to take a look at tooth eruption, to evaluate the bite, to see if there's any skeletal discrepancies between the upper and lower jaws, to see if there's any habits that are present. I mean, it's a really good age for us to kind of get a snapshot of what's kind of going on with their teeth and their bite, and help guide sort of what future treatment needs they may have. Some kids need early treatment and some don't. And it just kind of depends on the severity of what their need is when they come in. So, most kids that come in, their tooth eruption is fairly normal. They have some crowding of their teeth. They have some minor bite problems. If we know that it's stuff we can fix later on, we'll typically encourage you guys to wait and do the treatment later once all the permanent teeth are in. But there's some kids that have more severe problems when they first come in for their evaluation, where we know if we do treatment then, it'll make treatment for them down the road much, much, much easier. And those are the ones that really benefit from it. So the kids that don't get treatment will typically just be placed in an observation program where they're seen every 6 months, and we just continue to monitor eruption of teeth until all their adult teeth are in, and then we discuss what treatment is going to be needed and for how long in order to kind of straighten their teeth and fix their bite at that point. For the ones that have major bite problems or issues with teeth getting stuck or tooth eruption problems at a young age, we'll discuss with you different options on what can be done kind of from an intervention standpoint to try to make things for them down the road easier. And what I've put together is like a small slideshow that just shows a couple of examples of some of the things that we look at. It's by no means a comprehensive list, but as we're going through this, you may see something on there and you may say, hey, that's something that I see that that my son or my daughter has. And if you see it and you're not sure about it, you can certainly call us and schedule an evaluation. I think a common point of confusion sometimes among parents is that they think that they need to have a referral from their dentist before they come see us. And they wait until they get a referral. And dentists are very good about sending you, but if you want to be proactive about it, you can certainly call us. You don't need a referral. We'd be more than happy to take a look and let you know if anything is going on that would warrant treatment. So in this first example that you see here, this is called a deep bite. We see this sometimes in young kids, and a lot of times we don't really do anything to fix it until later on when they're ready for full braces. But sometimes in the cases of severe deep bites where you can't see any of the lower teeth at all, the lower teeth can sometimes erupt so high up behind the upper front teeth that they hit the roof of the mouth and they can cause gum trauma to the gum tissue in the roof of the mouth. Also, sometimes with a deep bite like this, because there's more pressure on those front teeth, based on that deep bite pattern, you'll see more wear in those lower front teeth. And in those instances, we may do something like a retainer that's worn at night, kind of to help out with that overbite and make it easier to treat down the road, and also to kind of get them out of that problem where they're doing damage to the gums or teeth. This is an example of what's called a crossbite of just a single tooth. It's in the front of the mouth. In this particular example, the upper tooth is hitting at a bad angle against the lower tooth. And when that happens, sometimes it can cause the lower tooth to tip forward, and you can have some gum recession problems at a young age on one of the lower front teeth. And just by wearing a retainer at night, tipping the upper front tooth out and fixing the bite, the gum tissue can improve, as they're kind of going through the rest of their growth and development and tooth eruption. And crossbites can vary. You can have a crossbite of one tooth, you can have it of multiple teeth. You can have it in the front, you can have it in the back, sometimes you can have it in both places. So in this example, this patient has a crossbite of their front teeth. They also have a crossbite of their back teeth. And that's the anterior is for front, posterior is for back. Bites like this typically have some sort of skeletal component to it where one jaw size isn't matching up relative to the other. And a lot of times kids like this will benefit from early treatment in the form of like partial braces, a palatal expander to widen their upper jaw, and sometimes even like a headgear to help out with fixing the front to back position of their jaws and how they bite. There can be tooth eruption problems that we can spot at an early age. In this particular example, there's a permanent first molar that's hung up under a baby tooth. Spotting that and identifying it at a young age makes it much easier to correct than waiting and letting that problem kind of get worse on its own. And there are different ways that we can treat things like that that involve either a fixed retainer or partial braces as well. Sometimes there can be a habit, whether it's a thumb-sucking habit or a tongue-thrusting habit, that's forcing the front teeth apart, and it creates what's called an open bite. As you can see here, the teeth have no overlap with one another. To give you an idea, an ideal overbite or vertical overlap of the front teeth should be about 10 to 20%. So when you have an open bite like this, there's no vertical overlap of the teeth, and simply by stopping the habit, those teeth can re-erupt into the correct position a lot of times on their own, as long as there's eruptive potential left in those teeth, and in most young kids there is. And the treatments for cases like this, they vary. Sometimes you don't even need to do any definitive treatment besides maybe reviewing some exercises or using a polish that you paint on the thumb or the fingers to stop the habit, and then the problem fixes itself. You can also have flaring of front teeth. Sometimes this is an aesthetic concern to a patient or parent, but more often the reason that we advocate early correction of it is if they're flared enough to the point that there's a risk of having trauma to those front teeth. A lot of times when they're flared outwards, they're the point of first contact if a patient, a young child falls and hits the ground, or they hit a door or a wall or something like that, and they are at risk of traumatizing those permanent front teeth. And with either partial braces or with a retainer, we can improve the inclination of those teeth and also close any spacing that may be present between them. Typically, like an early treatment on a young child, 7, 8, 9 years of age, if it does involve braces, normally it's only about like 10 to 12 months. We try to keep it around that at most, and that usually is enough to accomplish the objectives that we're out to try to achieve. So that's pretty much all for this post. If you have any questions or comments, please post them below. And if you feel that your child would benefit from having some evaluation done in our office, their first evaluation, just give us a call. We can certainly get them scheduled. Thanks so much. Take care.